Hello, everyone. Dr. Nick Hilverma here with another edition of Things I Didn't Learn in Med School. Today, I want to talk about the tragic passing of James Van Der Beek this past week. For those of you that don't know, he was a celebrity that was popular in the 90s and early 2000s. He played uh, a big role in the TV show Dawson's Creek. And the movie that I most remember him from was Varsity Blues. And he had a pretty impactful acting career as well as impact on society and the people's lives who he was a part of. The, the passing has shown a collectiveness of people from my generation, millennials, coming together and kind of honoring him as an individual and remembering the greatness that he did have for the world. And for me, it was definitely a step back to take a look at the bigger picture, especially when he put out this video recently before his passing about what it means to be a person. And partially, he was discussing, at first, he identified himself as an actor. And then eventually, he became a husband. And that felt better than being an actor. And then he found more solace in being a father, a good father, a loving father. When he found out his cancer diagnosis in 2023, they kept most of the story under the hood. They did not want society, they didn't want their friends and family to worry. But as the years went on, he started questioning, who am I? If I'm not able to be this father, this husband, this actor, who am I truly? And in his powerful, moving speech, he talks about what he meditated on and prayed upon. And I don't want to get too religious on this channel for this video, but it was very heartwarming to see what he found in making his own terms of finding love within himself because he knows he's worthy of God's love. And if you haven't seen the video, I highly recommend you go checking it out and kind of walking through that journey and seeing in his eyes where he was at the end stages of his battle. The next portion that came up for me during this week is it turned out that him and his family actually had some financial strain. I'm not going to say it's difficulty or they were broke, but they had some strain that came about through this cancer battle. So again, he was diagnosed with colorectal cancer in 2023. And it was stage 3. And this requires different treatments and various treatment options, and usually in collaboration. So he had certain surgeries. He took chemotherapy agents. He did lifestyle modifications, et cetera, et cetera. But what's troubling and heartbreaking and really gets you to your core is this individual who was, by the societal norms of successful, was struggling to make his family feel supported because of the financial strain that all these medical treatments placed upon him and his family. Hundreds of thousands of dollars. And this is an individual, from all accounts, had good insurance, had access to good doctors and copays and etc. And I don't see anywhere that he did highly experimental procedures. This is all basic standard of care. And they were still under financial distress. And it makes you wonder what happens to other individuals that don't have that same funds and resources. Just reviewing what came up on Oncodalia as an oncology paper, they talk about stage 3 colorectal cancer treatment is about $150,000 a year. Surgery is about $30,000. Chemo is about $50,000 per cycle, and surveillance can be up to $20,000 itself. Then you also have travel time. You have loss of income. You also have all the other things, the side effects of chemo that might come up that you might need treatment for, changing your diet. You might also have to hire else other aides and support to help with your kids or family or yourself. The systemic inequalities that do rise from this, it talks about in this article, where 25% of patients will purposely delay care due to costs. I'm not one to say that universal healthcare is going to solve all these problems, but it does make you stand back as a human and sit down and think, what is absolutely best for our world and our nation and our individuals and our citizens and our family members and ourselves? It's a little heartbreaking, right? Because this was an individual who had such great impact in the world. And granted, he was an actor, and you can think and say what you want about actors, but it seems like he did live a pretty healthy lifestyle. He was active. He was a good father. Countless other celebrities have stated his impact on their lives. Again, the millennial generation, lots of friends and family members are posting what impact he had on their lives. And I wonder what's going to happen next and where we're going to go next with all of this and what the solution to situations like this will be. I'm in the camp that people should not have to undergo significant financial burden to fight to see another day. And that's what some of these things are, fighting to see another day. Some cancer diagnoses nowadays are not even terminal. But if you don't have the right tools and the right resources, you may not be able to go see the next day. And when we have 25% of US patients delaying care due to cost, that's not setting us up for a successful future. Another thing that troubles me about the whole situation is how the government and the insurance companies don't seem to actually have a grasp on how to fix this, nor are they willing to fix this. Is this because of lobbyists? Is this because of pharmacy benefit managers? Is it because of, hey, that's just how the world is and we are getting more cancer because of increase in obesity and dysbiosis and poor diet and alcohol and drugs and smoking and et cetera, et cetera. I don't know, but that doesn't seem like it's the proper thing as a physician who, when our goal is to heal and heal primarily, we're going up against this monster, this battle that almost feels unbeatable. And you can see, and if I hope you see how troubled I am about this situation because it's not a good situation. In the past 5 years, I've had several of my colleagues and friends be diagnosed with various types of cancers. Two were colorectal cancer, one was lung cancer, one was breast cancer. Otherwise, healthy individuals, from what I can see, they're active, they work out, they exercise, they eat healthy for the most part, they avoid drugs and alcohol, they don't smoke cigarettes, et cetera, et cetera. But they were still diagnosed with these conditions. Now, you hope that you caught them early enough. Unfortunately, I know one of them did pass away, uh, who had a big impact on my life, and made he rest in peace. Um, the other three are still kind of doing okay. I think one is cleared of diagnosis of cancer. One was is still going through treatment right now, and we'll see what the outcomes are. The other one is going through treatment as well. I think they're on their back end. And that's just the younger generation. I have a really good golf friend who's a little bit older, who's also has been diagnosed with prostate cancer. He went to the best prostate specialist in Columbus and he got great treatment. And, hopefully, knock on wood, everything looks good over the next few years that his PSA and his prostate cancer has been, ablated and subsides from there. But I think what's important is that we start listening more and more to the guidelines that the U.S. Preventative Task Force has put out. And we'll give this as a educational portion and a call to action of colorectal cancer screening. And right now, the guidelines recommend that you get screened at the age of 50. But we're starting to see more and more recommendations recommended at the age to 45. And because there's an earlier onset of this colorectal cancer, again, due to maybe obesity, processed food, microbiome dysbiosis, alcohol, smoking, et cetera, et cetera. There may be a field that if you have a higher degree of risk in your family, that you get screened at an earlier age, 40, 35. I don't know. I'm not, an expert in these kind of fields, but what I do know is we're starting to see these kind of things more and more frequently. And my colleague that developed lung cancer, he had a cough that wouldn't go away for a year. And that alone isn't enough reason to go and just get a MRI of the chest, but when something didn't feel right, it didn't look right, he got his chest x-ray and something kind of came up hazy and he went and got his CT scans and MRIs, he didn't delay. He did not sit around and wait and say, oh, it'll go away, it'll go away. He questioned what was going on. And thankfully, he was able to get into treatment and hopefully he'll be fine. And they've caught it early enough. But the problem is we don't know. But that is the number one thing that we can do. Obviously, we talk a lot about preventative care, and that is why I harp a lot about exercise, anti-inflammatory diet, low stress, avoiding drugs and alcohol, avoiding smoking cigarettes. These are all beneficial things to the body and also will increase your chance of living a healthier life and hopefully decreasing your risk of cancer. But the number one thing outside of that to do is have your regular checkups and preventative screenings. I'm not one to say you need to have a full body MRI because that might be too much, but we have certain guidelines and certain recommendations that can be tested for and checked for. Breast cancer screenings, cervical cancer screening for women, skin cancer checks, colorectal cancer screening. If you're a smoker, to getting a low dose CT scan can be recommended. And these are just some of the cancer related topics. There's probably several others that I'm missing off the top of my head, but those are the ones that are jumping out to me, and those thoughts are kind of fresh in my mind. So I implore you to go and talk to your physician and see if you need to be screened. And if you have a family history, then push your physician to see what are the next steps to make sure your screening is appropriate. Blood work doesn't always show the whole story. Sometimes you need more, and sometimes you need more data to know what's going on. And those preventative choices that you make in your lifestyle, added in with good screening, hopefully will catch any problem early enough so you can still be with us past the age of 48, where James Van Der Beek passed away. I hope you guys found this useful, or at least informational, and you can take this information to your family, to your physician, and you work with them to try to get a better and healthier life. And I also hope that you share my worry about the current medical industrial complex and where we're going. And I don't want you to worry in the sense that I'm worrying, but that it invigorates something inside of you, lights that fire, that burn, that urge to go out and talk about these things, and hopefully we can make a change, and a positive change in the world in the long run. I hope you guys found this useful. Again, please drop me some comments, some likes, subscribe button. If you have any questions, feel free to send me a message, and we'll talk to you next time. Take care. Bye.